The Food and Drug Administration has approved the next round of COVID shots for the fall, but only for a more limited group of people. The updated vaccine is approved for adults 65 and older. The FDA also gave the green light for kids and adults with at least one medical condition that puts them at risk of severe illness. Health and Human Services Secretary Robert F. Kennedy Jr. announced the approval in a post on X today. The new restrictions are likely to affect what insurance covers, especially for people who do not qualify for the updated COVID shots. According to the CDC's vaccine price list, a COVID shot could cost up to $140 without insurance. Right now, Health and Human Services Secretary Robert F. Kennedy Jr. is in Texas. He is joining that state's Republican governor, who is signing 3 state bills related to President Trump's so-called Make America Healthy Again, or MAHA agenda. The first bill, orders warning labels on items with 44 common food additives. The second bill in Texas adds new limits on what food recipients of government food assistance can buy. And the third bans 7 food additives from free and reduced price school lunches there. NBC News medical reporter Berkeley Lovelace joins us now. So Berkeley, what does this mean for Texans and the food they buy? Could these bills have any impact beyond the Lone Star State as well?
Yeah, so these bills are really interesting because they focus on food additives rather than individual ingredients such as sodium or trans fat. So starting in 2027, people in Texas could start seeing warning labels on their food, such as Doritos and M&Ms, these really popular food items. Also, there could be some new requirements for public schools, so new nutrition, education requirements, or new physical activity requirements. And I think this is actually a roadmap of what Kennedy wants to do nationwide. So it's important to note that the jury is actually still out on whether or not food additives are indeed linked to health issues in people. So there was the FDA did ban red dye number 3 in January over concerns about possible health risk, and that was included in this Texas bill. There are also a number of other additives in this bill where there are possible concerns about hyperactivity in children. But I would say a lot of these additives, there still is not yet a definitive link. And so it's unclear whether or not this will have a huge impact on chronic health disease in children, as Kennedy says. But it's also, I would say, a lot of food experts generally agree with Kennedy that the food supply needs to be cleaned up.
And we're seeing other states take similar measures, right? So are there other things that Kennedy wants to move forward nationally?
Yeah, so there are actually nearly half a dozen states who are pursuing bills just like these, and that includes West Virginia and California. Another item on Kennedy's list is ultra-processed foods, and so he recently took the step to define what an ultra-processed food is, and I'm told that can open the door to regulation, and ultra-processed foods have been linked to a number of health issues. Kate.
All right, Berkeley Lovelace for us. Thank you, Berkeley.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.